Before I was an acupuncturist, I was an archaeologist. It was something I was very passionate about and something I'd wanted to do since I was a small child. And I spent most of my time out in the field and in the lab looking at samples. Things started to get much more stressful at work and started to have a much bigger effect on my health. And to try and help me keep going, I started going to the student acupuncture clinic for treatment. And that was important for me because although I thought an acupuncturist was amazing and it wasn't something I could do, in watching the students and how they developed as people and practitioners, I realised that actually it was a process and that perhaps I could learn how to do it too. And at that point, it's the most terrifying thing I think I've ever done. I decided to train as an acupuncturist. What appealed to me about acupuncture was the Chinese medicine, the clinical reasoning, that the process that took my symptoms and arranged them into different patterns and then treated those patterns. And it was the whole of that understanding of how that worked that really interested me. What do I like most about my job as an acupuncturist now? There are two things. One is listening to the patient's story, and while they're talking to me, I'm reframing the information that they give me in terms of how Chinese medicine understands health and disease. And in doing that, I can often make sense of it and feed it back to the patient in ways that give them more control about their health. And I really find that gives them a lot more control and empowers them. And that's great. And then I can carry on treating them and they can do something as well that will also help their health. But the other thing I like is being a partner to that, helping somebody move back to a state of health and being, I suppose, a witness to that in a way. Yes, I really like learning, and Chinese medicine's fascinating, and so I have undertaken short courses in all sorts of different things. Initially it was Japanese acupuncture, so I did quite a few courses and seminars in Japanese acupuncture, and I've also found Chinese herbal medicine absolutely fascinating and have studied, and I'm also a Chinese herbalist now too. That's another 3 years. That was jolly hard work, but so rewarding. I find pulse diagnosis fascinating and wonderful, and I've done further training in that. For somebody considering a career in acupuncture is to really do your homework. You need to find a course that you know is going to give you the professional training that you need. Acupuncture is so much more than just sticking needles into somebody. You need to understand all the Western medicine side of things, medication. There's the whole side of needing to grow as a person, because you'll be an independent practitioner, so you need to be mature enough to be able to cope with what your patients tell you. So it's really important to get a proper training. I would advise people to go and look at the BAAB website, because that gives you some assurance, some quality assurance that the courses listed there are have reached an appropriate standard. The other thing I'd say was that it's really important to find the course that's right for you. There are a range of different courses with different flavours and strengths, and you need to go and look at the websites, and you need to go and visit the courses, visit the colleges, meet the staff, talk to the students who are on them, find out what it's really like, and choose the one that's right for you.